Welcome to Med in 5. The goal of our channel is to help you understand medical concepts like a breeze. This video is part of a series explaining bacterial infections. Today, we're focusing on Streptococcus. Let's start with these questions. Which strep species causes strep throat and rheumatic fever? Which one is the most common cause of neonatal sepsis? Which one leads to dental caries? Stick around for the answers. All strep species are gram-positive cocci that typically form chains or pairs. Unlike Staphylococci, Streptococcus are catalase negative. They don't bubble in hydrogen peroxide. They're classified based on hemolysis patterns on blood agar and by Lancefield grouping, which reflects carbohydrate antigens on the bacterial surface. The latter system, developed by microbiologist Rebecca Lancefield, classifies strep into groups A, B, C, and others based on these specific antigens. First up, Streptococcus Pyogenes, also known as Group A strep or gas. This beta hemolytic species fully lyses red blood cells, leaving clear zones on blood agar. Gas commonly colonizes the oropharynx and skin. It's a leading cause of pharyngitis, aka strep throat, impetigo, a crusty skin infection, and cellulitis, marked by red, swollen skin. It also causes more severe diseases like necrotizing fasciitis, or rapidly spreading tissue death, and strep toxic shock syndrome. Strep Pyogenes produces several virulence factors: M protein, which helps the bacteria evade phagocytosis, streptolysins, which lyse host cells, and exotoxins, which trigger massive immune responses. Complications of strep pyogenes can arise even after the infection clears, often due to autoimmune responses triggered by the infection. These include rheumatic fever, which affects the heart, joints, and brain, and produces valvular heart disease as a complication. Post-streptococcal glomerulonephritis, a kidney condition marked by hematuria, hypertension, and edema. PANDAS, where antibodies cross-react with neurons, leading to behavioral and movement changes. It commonly affects school-age kids. Guttate psoriasis, a sudden eruption of small, drop-shaped scaly lesions across the trunk and limbs. Several forms of vasculitis, which involve blood vessels and may present with palpable purpura, arthralgias, or renal involvement. Penicillin is the treatment of choice for gas infections. Next, Streptococcus agalactiae, aka Group B strep, or GBS, another beta hemolytic species. It colonizes the vaginal and rectal mucosa and is a major cause of neonatal infections, especially in babies born to GBS-positive mothers. GBS can cause neonatal sepsis, pneumonia, and meningitis, especially in the first week of life. Routine screening during pregnancy and intrapartum antibiotic prophylaxis with penicillin help reduce the risk of neonatal GBS disease. GBS infection is rare in adults, but it can cause invasive diseases, such as endocarditis, pneumonia, and osteomyelitis. In people with comorbidities such as diabetes or immunosuppression. Now, Streptococcus pneumoniae, aka pneumococcus, this alpha hemolytic, non-Lancefield group partially lyses red blood cells, producing greenish zones on blood agar. It lives in the upper respiratory tract and has a characteristic lancet shape. It's bile-soluble and opto-chin-sensitive, helping to distinguish it in the lab. Strep pneumoniae is encapsulated. The capsule is its main virulence factor and a target for vaccines. It commonly causes pneumonia, often with rust-colored sputum, meningitis, otitis media in children, and sinusitis. Treatment usually starts with empiric coverage using ceftriaxone, adjusted based on susceptibility test results. Vaccines like PCV13 and PPSV23 help protect against invasive disease. Finally, Viridans group Streptococcus. This is another non-Lancefield, alpha hemolytic group, but it's found in the oral cavity. Key members include strep mutans and strep mitis. Viridans strep are notable for dental caries due to acid production from sugar metabolism and subacute endocarditis. Occurring in people with valvular heart disease weeks to months after a dental procedure, viridans strep are opto-chin resistant and bile insoluble, unlike pneumococci. Treatment depends on the infection site and bacterial resistance, but may involve penicillin or ceftriaxone. Now, let's review. Which strep species causes strep throat and rheumatic fever? Answer: Strep Pyogenes. Which one is the most common cause of neonatal sepsis? Answer: Strep agalactiae. Which one leads to dental caries? Answer: viridans group strep. Did you get all the answers right? Fantastic! If this video helped you understand the strep species better, don't forget to like, share, and subscribe. Click the link below to access a quick reference table comparing their features and test results. Thanks for watching.